Hello, everybody. My name is Jocelyn, and I'd really like to thank you for taking the time to be here with me today. The topic that we're covering is STDs, STIs, and having safe, responsible sex. A little bit that we'll be going over today. Well, we're going to talk about why safe sex and why it's so important for us to start a conversation about it. We're also going to look at some definitions. What is an STD? What is an STI? And are they the same thing? We'll then look at some statistics and signs and symptoms of some of the more common STDs and STIs. And then we'll lead that into a conversation about some preventative measures. And before we get into all of that, I do have an activity to get started with today. On the screen, you will see that there are 7 true or false statements. And what I'd like you to do is take a moment. You can pause the presentation, read through each one, and jot down whether you believe each one to be true or false. And if you are unsure about an answer, feel free just to put a star or make a mental note. You can use a piece of scratch paper. You can use your phone. I also have the activity printed up in the handout, so if you have that in front of you, you can follow along that way. And we will get to each of these answers at the very end of the presentation. So go ahead and take a moment. You can pause now, and then when you're ready, hit play. All right. So the first thing that we're going to be doing is we're going to be introducing the topic of why. Why is it so important to cover the topic of STDs and STIs? And why are we talking about how to have safe and responsible sex? In a study conducted by the colleagues listed below, their sample of college students, they found that many of these young adults believed that their sex education that they received in adolescence was insufficient, and some of the words that they used to describe their education was outdated, awkward, and not helpful. And many could even recall their educators having used scare tactics to scare them into not having sex and pushing abstinence. And also what we find today is that there's a debate among parents as to who is responsible for even teaching adolescents about sex education. Should it be the parents or should it be the sex educators? And everybody has their different boundaries. But what it comes down to is many parents of these young children are afraid to talk about sex. They have fear and anxiety surrounding the idea of having sex talks. And a lot of the times this might stem from their own lack of knowledge, or maybe they don't want to promote sex in as a positive of a manner. And we'll get to that a little bit more at the end of the presentation. So when we look at adolescents today, we see, when we try to determine who knows what, we see that there's a discrepancy in the applied knowledge surrounding STDs and safe sex among adolescents today. So colleagues and gens below, they conducted a study with a sample of 532 adolescents between the ages of 10 and 19. And what they found is that yes, about 90% of these teenagers could identify or conceptualize what exactly an STD is. They found that only about 37% of girls and 30% of boys, give or take, could identify ways that they could prevent contracting STIs and STDs. So as we move forward, we want to start thinking about the definitions and how can we help educate these young people and these young adults and maybe even older adults about sex and safe sex practices and what is exactly what. One of the first things we'll look at is the difference between an STD and an STI. And STDs are sexually transmitted diseases. These are diseases caused by STIs or sexually transmitted infections. So to quote the source below, all STDs start out as infections. And so, what is an infection? Infections can be bacterial in nature, they might be viruses or parasites. And it's very important to understand that not all infections develop into diseases. And we can take HPV, for example, or what we would know as human papillomavirus. This is an STI or an infection that sometimes, in many cases, will go away without ever having caused significant health problems. However, HPV is a common example of an infection that, if left untreated, it can develop into something more serious. It can develop into an STD. And HPV can develop into cervical cancers, genital warts. And so what we see is STDs are infections that have become a disease. So there is a difference between STD and STI. All STDs start out as infections, and if left untreated, they turn into STDs, diseases. So let's dive a little bit into the statistics of it all. According to the CDC, 1 in 5 people in the United States have an STI, and these statistics are taken from 2018. And in this year, we saw that 68 million people had STIs. And in that same year, there was 26 million new cases of STIs. So 26 million of those 68 million were new cases, and almost half of these new cases, so about 13 million, were young people, adolescents and young adults between ages 15 to 24. And according to some sources, they might go as low as 14. But with this CDC statistics, about 13 million new cases of STIs were contracted in 2018. And so with these such large and staggering numbers, it's very important to understand what are some of the most common STDs or STIs that can develop into STDs. These include chlamydia, gonorrhea, syphilis. These are the 3 most common. And so chlamydia is the most common, with about 1.8 million cases in 2019, which is an increase of 2.8% from the previous year. We also see gonorrhea is going up 5.7% from the last year, with just over 600,000 cases. And then syphilis is up 11.2%, with just under 130,000 new cases in 2019. So as we look at these statistics and we see how prominent these infections and diseases are among young people and just among the general population, it's very important for us to dive in a little bit deeper and understand, well, what can I even expect if I have developed this? Will I know if I've developed this? Will it hurt? Not always. So chlamydia, for example, again, this is the most common STD in the United States. It is a bacterial infection, and it spreads through sex fluids, vaginal, anal, and oral sex fluids. We know these as semen or cum, pre-cum, and vaginal fluids. And with chlamydia, there's usually no symptoms. So you can contract chlamydia and not even know that you've contracted it. And that's very unfortunate, because chlamydia is one of those that is very easy to treat with an antibiotic medication. And if left untreated, it can cause some serious consequences, such as infertility. So looking at chlamydia, what can you expect maybe if you've developed this? What are some of the signs and symptoms to look out for? You might experience pain or burning while urinating. You might also experience pain during sex. You could have pain in your lower abdomen or abnormal vaginal discharge. If you're a male, you might experience milky discharge from the penis. You might have swollen or tender testicles. You could even have pain or bleeding around the anus. And in addition to these genital areas, chlamydia can affect some of the areas of your head. It can get in your eyes and your throat. And with your eyes, you might experience some redness or skin discoloration. It could be a little bit itchy. And then, yes, chlamydia can be developed in the throat, and this is rare, but it's important to point out that the symptom that you would experience is soreness. And yes, we live in a world of COVID nowadays. However, prior to COVID and maybe even after COVID, what do you think when you consider, oh, I have a sore throat? Maybe I have the flu, a cold, I might have strep throat. Our brain doesn't automatically go to, maybe I contracted an STI and I need to go get this treated. So we're starting to get into the importance of understanding why it is so important to get tested. Gonorrhea, the second most common STI or STD in the United States. Again, gonorrhea, just like chlamydia, is a bacterial infection, and it can spread through those sex fluids. Most people might not experience any symptoms, and this is another one. It's very easy to treat. If you get tested and you catch it early, you can treat this. It can infect all the same genital areas, the penis, vagina, cervix, anus, urethra, and then it can also come up here and be in the throat and the eyes. And again, this is rare. You'll see that there are some similar symptoms as we saw in the previous slide with chlamydia. Again, pain during sex, bleeding between periods. A new symptom on this slide would be pain when pooping. And it can also affect the eyes and the throat. But again, these are rare. And last but not least, we have syphilis. And syphilis is a little bit different. This is a much more severe case of STI that can develop into an STD. It is a bacterial infection, and it can be treated with antibiotics. Hopefully, if we catch it early enough, we need to get tested. But what makes syphilis different than chlamydia or gonorrhea is that syphilis, yes, it is spread through sex, but it is not spread through sex fluids. It's more so spread by direct contact. If you think skin to skin, there's no cum needed for the spread of this. And what you commonly see with syphilis is that it'll cause sores on the genitals. And these sores are generally painless, so it might not be something that we notice or are overly bothered by. And that's, again, very unfortunate, because if left untreated, syphilis can cause permanent damage. It can cause brain damage, paralysis, blindness, and as we move forward, we will see that syphilis can even lead to death. So syphilis, when we break it down into its stages, it has the first stage is a primary stage. And Planned Parenthood has a nickname for syphilis, and they call it sneaky syphilis because it does sneak up on you. The sores that you experience, they'll be round, firm, painless, and they may appear anywhere between 3 weeks to 3 months after infection, so after you've contracted it. And these sores can last up to 3 to 6 weeks. They can be found on the vulva, the vagina, anus, penis, and the scrotum. But in addition to these genital areas, we also see it up here, near the mouth, or in the mouth, or on the lips. Syphilis is one of those infections that can be confused with pimples, rashes, or possibly an ingrown hair. So you might have a rash, but here, as we get into the secondary stage, you'll notice that rash doesn't necessarily itch. So again, it might not be bothering you as much. People can see rashes on the palms of their hands, on the soles of their feet, and these can stick around for anywhere between about 2 to 6 weeks, and they can come and go for 2 years. 2 whole years they can come and go. With syphilis, some of the common symptoms resemble what we think of as a normal flu. So somebody might feel tired, they could have a fever, their throat, again, soreness in the throat. They might have swollen glands or their head hurts. I mean, how many of us have headaches all the time? Muscle aches. So when I describe these symptoms here, you think, wow, I must have a flu or I must have a cold. You don't think maybe it's a little bit more. And some of the side effects with syphilis is that somebody might experience weight loss, they can experience hair loss, and again, the sores can develop both in the genital areas and in the areas up here with your oral orifices. And then we get to the late stage, and this is the stage where it's almost too late, if not too late. Syphilis can lead to tumors, blindness, paralysis, tissue damage, and again, death. So, very important to start educating our youth on what can you expect if you have sex and you potentially contract an infection. You need to know what to expect so that you know the importance of, I need to get tested. And now we'll move on a little bit into some of the preventative measures. How can we have safe sex? We can have safe sex and we can prevent STIs by, according to the CDC, 1, choosing abstinence, 2, having fewer sex partners. We can also use condoms. We can take preventative measures by getting our HPV vaccination so that we don't develop that human papillomavirus and then not even know that we have it. We can spark a conversation with our partner, talk to them about what they expect from their partner and maybe the importance of getting tested and learning how to follow that protocol, especially if you've had unprotected sex. And before I move on, as I look at this list, the first two kind of stand out to me because one of the things, as I mentioned in the very beginning, is a lot of educators push abstinence, and then even having fewer sex partners, that kind of goes along with the pressure to say no. And as a society and as a culture, when we push abstinence and when we use those scare tactics that were mentioned in the beginning, we start to create a negative stigma around sex, and this can lead to other negative side effects, such as cognitive distortions, including all or nothing thinking or that black and white thinking. When you have young people or people of all ages really thinking, I'm bad if I have sex before marriage, or I'm bad if I have the desire to say sex, I'm a prude if I say no to sex. We just create this sort of negative stigma around it, and that can lead to other mental problems. So as we move forward with the presentation, we start talking about the importance of talking about sex. So one thing that I personally would like to add to this list is talking about sex. And when we talk about sex, this can help not only by talking about ways to protect yourself can you prevent STDs and unwanted pregnancies, but it also helps to increase our self-regulation skills and those executive functioning skills. It increases self-awareness, it improves our thinking, and it improves impulse control. And these are all things that we need to cultivate healthy development. And that healthy development is very important in those young years to develop into healthy adults as we get older. And a lot of parents, when we talk about the importance of being open about sex, this is where the anxiety and the fear come into play, because we don't know what to say versus what not to say. And Ashcraft and Murray help guide parents by talking about the things that are helpful to say, and that is to stick to the facts. So for example, they say you can tell your adolescents that engaging in sex can lead to pregnancy. It can lead to disease and even abuse of all kinds. And that is very important to acknowledge those negative consequences. And then there's also another side to that. Engaging in sex can be pleasurable, especially when it's done right and with consent and with somebody that you trust. So there are two sides to the coin, and that positive side of the coin is the part that a lot of parents have anxiety over pursuing. And then before moving on, Ashcraft and Murray also talk about what not to say. So it goes back to how we create the stigma or how we create the story around sex. Saying things such as don't have sex. Again, that can lead to that all or nothing thinking. Stay away from boys. Am I bad if I want to be around a boy, or am I bad if I want to be around a girl? A lot of parents, they don't want to unwillingly promote the sex. So again, one of the biggest tips from Ashcraft and Murray to all parents is resort to the facts. Remain sex positive to prevent those cognitive distortions and to support that healthy development. And an example of this could be, if you decide to have sex, it is important to use a condom. Condoms help prevent STIs and unintended pregnancies. And what we see in this short statement right here is a quote from a parent who is supporting their child's autonomy. They're instilling values and instilling boundaries around sex. And this can also lead into a conversation in which the parents can share their own experience from their teen years. Maybe things that you wish you had done differently. Maybe some of the negative consequences that you experienced because of your choices. And this can appropriately bring out the conversation of both the positive and the negative to sex. And Ashcraft and Murray also talk about it's important to engage in ongoing conversations versus having that one-time conversation. Okay, we talked about the birds and the bees when you were 5, when you were 6, or when you were 10, whatever age it was, and we don't need to talk about it again. Or the school will teach you, or your friends will teach you. And there can be pros and cons from getting information from the school or from your friends, but that one-time conversation might not be sufficient enough, and it might not have been age-appropriate enough there's a difference between 5 years old and 10 years old and 15 years old. So an ongoing conversation can, again, help support that healthy development. And then circling back around to this list, there's one more point for prevention that we're going to talk about today, and that is bullet point number 3, using condoms. Using condoms are the most effective way for preventing STDs, second to abstinence. And when used perfectly, condoms are 98% effective. But as Planned Parenthood likes to remind us, people aren't perfect. So that statistic of 98% significantly falls to 85%. Condoms on average are 85% effective. So therefore, how can you increase the effectiveness of your use of condoms? You learn how to use them correctly. And there are things that we can all learn to help us use condoms and other preventative measures correctly. With condoms, there are 2 different kinds, and most of us are familiar with the male condoms, and this is called external condoms. I'm not going to open these resources here, but I have these resources for any parents who might be thinking about how can I start engaging in safe sex practices and that conversation with my children. So Planned Parenthood offers a tutorial and a guide for how to use external condoms, and then they also offer a guide, or the CDC offers a guide for how to use internal female condoms. And in my additional resources section here, again, I'm not going to open these here and I'm not going to play this video, but Planned Parenthood offers a step-by-step tutorial for how to turn a condom into a dental dam if you don't have a dental dam. And dental dams and then condoms are two separate things. And these are adequate resources that you could use as a parent to help you bring about that conversation in home. Planned Parenthood also has a 2 to 3 minute video about STDs and safe sex. It provides an overview, and so depending on any conversations you've had previously or the age of your child, this video may be a helpful icebreaker for starting that conversation in home. And as we wrap up, we're going to get back to that activity. So now we're going to go through each of these questions one by one and decide whether they're true or false. So, number 1, many people believe the sex education they received in adolescence was sufficient. This is false. Many people believed that their education was insufficient, and that is why there is a demand to learn about safe sex practices from professional organizations. Number 2, an STD and an STI are the same thing. Again, this is false. There's a difference between infection and disease. An STD is a disease and an STI is an infection. And to segue into number 3, all STDs, this is true, they do start out as infections. Number 4, 1 in 5 people have an STI in the United States. Again, this is true. The CDC tells us 1 in 5 people do have an STI, and there were 68 million cases in 2018. Chlamydia, number 5, is the most serious STD in the United States. This is false. Chlamydia is the most common STD in the United States. But if you recall, again, segueing into number 6, if left untreated, syphilis is one of the more serious STDs in the United States and can be fatal. It can lead to death. Number 7, when used perfectly, condoms are 98% effective at preventing STDs and unwanted pregnancies. This is true. Second to abstinence, we want to be using condoms. And again, people aren't perfect, so that statistic generally falls to 85%. Hence the importance of understanding how to properly use the condom. If you've made it this far with me, I would like to thank you for being here and having listened to this presentation. And I know we're all coming in with different levels of knowledge, and my hope is that everybody walked away with at least one new piece of information that they learned, and so that we can continue to educate ourselves and use that information to educate young persons moving forward. Thank you.